We spend 1/3 of our lives sleeping, and yet we know very little about what it's actually doing and why we need it. As healthcare costs are rising out of control, better sleep, increasing the quality of sleep, and more sleep may be one of the non-pharmaceutical tools that we need to get out to the community as to how to maintain health. We began down the road of sleep medicine research about 3 years ago, and we had a study funded by the National Institutes of Health looking at the effects of total sleep deprivation on neural and cardiovascular control. And the preliminary evidence from that study is pointing us in the direction that we need to partner strongly with a clinician, especially someone like Dr. Smoot at an accredited sleep disorder center.
It's just an unbelievable opportunity for us. We have an American Academy of Sleep Medicine accredited sleep center. Only 20% of sleep studies are done in accredited sleep centers in the U.S. So we're very lucky at Hancock at Portage Health to have an accredited sleep center and have the opportunity to work with tech in a collaborative way to work on some of these studies.
We look at how the sympathetic nervous system responds to various types of stressors, including sleep deprivation, and we want to understand how we can maybe reduce that sympathetic traffic during those times when you don't want sympathetic traffic. We know that 1/3 of Americans suffer from hypertension, and that's one of the diseases our lab is extremely interested in. And preliminary data out of our laboratory and others are suggesting that sleep deprivation contributes to that. Now, what we need to do is take that data and move to newer models. We need to move to models where we're looking at sleep restriction, which is not 24 hours, but a series of nights of sleep restriction. And more importantly, we need to look at-risk individuals. And Dr. Smoot will be able to provide us an opportunity to access some of these at-risk individuals, such as sleep apnea patients.
Obstructive sleep apnea is defined as either stopping breathing for 10 seconds at a time completely, or decreasing your breathing 50% for 10 seconds with your oxygen decreasing at least 4%. So the first one is called an apnea, the second is called a hypopnea. And those together make the apnea-hypopnea index. Because when you stop breathing, many times your oxygen drops, and sometimes it drops to alarmingly low levels. Your oxygen at night should never be less than 95%, and we see people routinely drop into the 70s, which would be the same as awake breathing up at Leadville. And we see people drop into the 50s, which would be the same as being at base camp on Mount Everest.
Sympathetic activity is not a bad thing. We need sympathetic activity to stand up every day. We need sympathetic surges when we're in danger. But what we don't need are sympathetic surges at night when we're in a state of trying to relax and actually quiet down the nervous system. Having a ramped up sympathetic nervous system throughout a night is going to lead to cardiovascular complications, and in the worst case, it could trigger a fatal cardiovascular event like a stroke or myocardial infarction. We use a technique called microneurography, where we insert a tiny tungsten microelectrode invasively into one of the nerves in the body in human subjects. And it is the only measurement out there where you can directly measure sympathetic nerve traffic in humans. There's a lot of other methods that can be used in animals, but this is the only approved method in humans. And so we have a very unique window into the autonomic nervous system of a human being.
I don't know anybody else who has that opportunity to work closely with just a fantastic research university. And have the opportunity to sit and talk to the professors, get your ideas out there, think about things that really need to be looked at. I mean, a lot of places are doing research on, rats and guinea pigs and all kinds of things. We're really more interested in trying to do research on things that will have clinical significance that we can take right from the study right to practicing physicians.
I think organizations like the American College of Sports Medicine have done a great job of convincing Americans that exercise and nutrition are important, and I view sleep as the third pillar of health. And so if we can convince and we can come up with data to suggest and further this idea, we're going to be making positive contributions that improve the overall health of our country.